வணக்கம், good morning. I am Dr. Prabhakar. In the video we are going to discuss about the oxygen transport. Oxygen transport occur in alveoli tooth tissue via blood. It is occur in the two forms. One is the by simple physical solution. Another one is the combination with the hemoglobin. As a simple solution, dissolve in water of plasma, 0.3 ml per 100 ml of plasma. So totally 15 ml is transported as the oxygen. That is, this is the 3% of the total oxygen transport in the blood. Only 3% of the oxygen is transported as the simple solution because of the poor solubility of the oxygen. Normally, 15 ml oxygen is transported as the simple solution. During the muscular exercise, around 250 ml transported as the simple solution for the meet the demand of oxygen during the exercise. 97% of the oxygen is transported as the combination with the hemoglobin in the form of oxyhemoglobin. 97% is transported as the oxyhemoglobin. 1 gram of hemoglobin carries the 1.34 ml of the oxygen. During the resting state, when the oxygen is not bind with the hemoglobin is present in the tense state or T state. When the oxygen is bind with the hemoglobin, it is converted to the relaxed state or R state of hemoglobin. Oxygen transported by the hemoglobin is explained by the oxygen hemoglobin dissociation curve. In the curve, x-axis depicts the partial pressure of the oxygen. It is expressed by the millimeter mercury. Y-axis is the percentage of the oxygen saturation of the hemoglobin. This is derived from the oxygen content. Oxygen content is the how much amount of the oxygen is carried by the hemoglobin divided by the oxygen capacity. Oxygen capacity is the how much amount of the maximum oxygen is carried by the hemoglobin multiplied by the 100. This oxygen hemoglobin dissociation curve explains the hemoglobin affinity for the oxygen. Normal oxygen hemoglobin curve is the sigmoid shape or S shape. The lower part of the dissociation, lower part is the dissociation of the oxygen from the hemoglobin. The lower part is the steep like structure up to the 0 to 60 millimeter mercury. It reaches the 90% of the oxygen saturation of the hemoglobin. Lower part is the steep and upper part is the slope like this. The lower part is favor for the dissociation of the oxygen from the hemoglobin. When the oxygen partial pressure of the oxygen is decreases, that oxygen is released from the hemoglobin. The upper part is favor for the acceptance of the oxygen by the hemoglobin. It depends on the when the POT is high, the hemoglobin affinity for the oxygen is more. P50 is at which partial pressure of the oxygen hemoglobin is saturated with the 50% of the oxygen is the P50. For the normal oxygen oxygen dissociation curve, it is the 27 millimeter mercury. PO2 at 27 millimeter mercury, 50% of the oxygen is saturated with the hemoglobin. This diagram depicts the shift of the oxygen dissociation curve. This is the normal oxygen dissociation curve, sigmoid shape oxygen dissociation curve. For the normal curve, P50 is the 27 millimeter mercury. When the curve shifts to the right side means it is easily releases the oxygen from the hemoglobin. It is occur in the when the 2,3 diphosphoglycerol level increases, when the temperature increases, when the pH is decreases. It is favor for the release of the oxygen from the hemoglobin. So it shifts the oxygen dissociation curve to the right side, easily release the oxygen. The saffron color is the shift to left. It is occur in the when the degrees 2,3 diphosphoglycerol level, when the temperature is decreases, when the pH is increases, the fetal hemoglobin, the myoglobin, the carboxyhemoglobin, it shifts the oxygen dissociation curve to the left side. It is more affinity of the oxygen with the hemoglobin. It does not easily releases the hemoglobin from the oxygen. The fourth effect is occur at the tissue level. When the CO2 enters the blood, oxygen dissociation curve shift to the right side. So it favor for the unloading of the oxygen at the tissue level, loading of the CO2. Simply says means when the PCO2 level more in the tissue, it favor for the release of the oxygen from the hemoglobin to the tissue. Summary: oxygen transport is occur in the two forms: simple physical solution by the 3%, 97% is combined with the hemoglobin as the oxyhemoglobin. The oxygen transport by the hemoglobin is explained by the oxygen dissociation curve. The oxygen dissociation curve, x-axis is the partial pressure of the oxygen, y-axis is the percentage of the saturation of the hemoglobin. The normal oxygen dissociation curve is a sigmoid shape. When the curve is shifted to the right side means it easily releases the oxygen from the hemoglobin. This mainly occur when the 2,3 diphosphoglycerol level increases and increase temperature, decrease pH. When the curve is shifted to the left side means it more affinity with the oxygen with the hemoglobin. It is mainly occur in the carboxyhemoglobin, fetal hemoglobin. When the 2,3 diphosphoglycerate level decreases, the decreased temperature increases the pH. The fourth effect occur at the tissue level. When the PCO2 level is increases at the tissue, it shifts the oxygen dissociation curve to the right side. It releases the oxygen to the tissue. Thank you for watching this video. If you like this video, share your friends. Those who are not subscribed this channel, please subscribe. Thank you once again.